Live from New York, it's Benefits with Friends. I am your host, Lou Bernardi. It's a beautiful early October day here in New York. We have a great show for you today. Hopefully, a real informative show, especially for any benefit advisors out there, HR leaders, consumers. People that are just really interested in healthcare, health insurance. So I'm going to bring in Mark Galvin. There you go. Hey, Mark, how are you?
Great, Lou. How are you doing today?
I'm doing awesome. It's the beginning of the fourth quarter. We're 3 days in, and I don't have an ulcer yet, so we're I'm ahead of last year, I think. So
Looking
so
forward
Mark,
to enrollments, I presume.
we're fortunate. We have some early large group renewals: August, September, October, November. So we've gotten 50% of our larger accounts out of the way already. Now it's a lot of small under 100 New York accounts we're working on. Ton of Decembers and some carriers dropping out of the market. So yeah, we have some work ahead of us, but I think we're a little ahead of the game. So, and I'm really dark in this video for some reason. I shut my blinds the other day and I broke the wand, so I can't even open them. But so for anybody that doesn't know me, my name is Lou Bernardi. I'm a benefit optimization officer. I don't know if you know that, Mark. I coined the phrase a couple of years ago. We're really focused on here at BrightPath on helping employers optimize their benefits, not just focus on buying that insurance that everybody's been buying for 30 years of managed care, have really wreaked havoc on companies, on people, out-of-pocket costs. These plans that I think deliberately keep the consumer in the dark, right? The people who are buying insurance, people who are deciding on which plan to select of the options that their employer might offer them, and then even more troubling when they enter the healthcare system and how badly they're taken advantage of there. So I've had my eye on Talon for several years now, and for several different reasons, and I want to talk about that. Most of the time we don't get really specifically into products, but I think that this is such an important topic, and you guys, the way you can address a couple of different things, that shopping experience, but also some legislation that plan sponsors. I was at a SHRM conference on Friday. I could tell you, I didn't find one person. I spoke to probably about 50 or 60 HR directors. None knew about the transparency and coverage, the No Surprise Act. I mean, almost none of them, because who do they rely on? Their benefit experts, who it's not a mandate on them. They don't want to have that conversation. Insurance companies certainly don't. So Talon, it says here from the bio, I guess you co-founded in 2014. So that was ahead of, this was ahead of the legislation. I mean, I'm really interested in finding out how you identified this need. And I know that you've been to the White House, you've been speaking, showing your technology to all of our esteemed leaders at the federal level. Can't wait to hear a little bit more about that. But why don't you introduce yourself? I know you have a pretty impressive background, a lot of different companies, and yeah.
Oh, thanks, Lou. Yeah. So, my name is Mark Galvin. I'm president and CEO of Talon. Some people know us historically as My Medical Shopper, which is the brand, kind of campy owl brand we started under. But as our products expanded and we're heavier duty into the analytics side, as well as all the shopping experience stuff that we've built out, we rebranded the company. We still use My Medical Shopper as the kind of the brand on the functionality, which fulfills the requirements for transparency and coverage rule of the Affordable Care Act, which we can get into a little bit.
Sure.
But I guess what's probably a little bit interesting about me is I'm not from the healthcare industry. I still consider myself a newbie, even though we started this company 10 years ago, and my life has been totally focused in trying to help, kind of move the needle on cost containment around healthcare costs for consumers. But my background and how I really got into this is I'm a serial tech entrepreneur. I did 4 venture capital backed startups, historically all in the voice and data communications, ISDN, voice over IP, internet software, remote access. Those were the industries that I served. I was, my third startup, which made number 2 on the Inc. 500, and they were all pretty rapid growth companies because, we kind of set our sights on what should be happening that wasn't being done. We have a pretty good gut instinct for what people would like to see happening versus what is happening. And so that company was called Cedar Point Communications, number 2 on the Inc. 500. We really helped the cable industry bring voice over IP to the entire country.
Oh, wow.
And so, we went from, some of us can remember the days of, 35-cent long distant minute calls on our copper wires, phone calls, to now, unlimited voice over IP around the world, and now like we're speaking across video over IP effectively,
right?
Which all leveraged off those technologies. So that's kind of where I came from. But how did I get kind of tied into benefits? Well, when you're a startup person, you're starting up new venture capital backed companies. Not only are you CEO, founder, but you're also director of HR.
Yeah.
And I'm also a little bit of a disruptive, innovative type guy who, takes very few things at face value. I'm very inquisitive about stuff. And it so happened that I got instructed by my family physician. I have a wife and 5 kids, so we were pretty frequent with the family doctor. He sold his practice to the hospital system locally, and he left it because he was sick of being told how he should operate his medical practice by insurance carriers.
Right.
And so he became the kind of early case of a direct primary care physician. Obviously, I went with him. He was having trouble getting people to sign up for.
That's a test of the national. You can't make this stuff up. Every time I'm doing one of these things. Anyway, hopefully it's a test. I know there's some bad weather heading this way, but it's going to be here Saturday for my son's wedding. So anyway, sorry about that.
So that I'm here in Portsmouth, New Hampshire. I'm sitting on the Piscataqua River, which is off my shoulder here, and all morning, the 1800 vintage Portsmouth Naval Shipyard, which services nuclear submarines, have been having warning things like that blaring into the city.
Very comforting.
Yeah. So
I don't think this was nuclear. I hopefully nothing's going on. But
the good news is that they're blaring, test, 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 and then they run through this thing. But it's happened like 3 or 4 times this morning. So anyway, so basically, I got schooled on high deductible health plans and health savings accounts by my doctor.
Yeah.
Because it turned out people on these kind of catastrophic plans, these HDHPs, had a tendency to sign up for his DPC service because they could pay a fixed amount and call him day and night and get whatever care they needed that a family practitioner could do. So it was really fabulous care. But this was the start of my awakening as an employer. Okay, so I think most of your audience are probably brokers, probably have some HR teams. Those HR teams maybe have the C-suite poking their heads in a little more frequently now because there's a lot of noise about the fiduciary responsibilities. And as people start to learn about this thing called the Transparency and Coverage Rule, which was added to the Affordable Care Act in October of 2020, they're going to hear about the fact that as an employer, you could face $100 per member per day fine for non-compliance with that rule. And these are potentially company killing fines. We roughly say, if you multiply members, certain number of members per subscriber, call it 2.2 or something, seems to be shrinking lately, but it's like $87,000 per employee per year potential fine against an employer for non-compliance with these rules. So,
wow.
But basically, I was an employer, right? And I was thinking about this high deductible health plan stuff, and I said, well, we always give platinum plans, $0 deductible platinum plans to our employees. We're in high tech. And I certainly didn't want to change that per se. I didn't want to expose employees to possible healthcare expenses, but it occurred to me that we could structure something a little differently, and I purchased the highest high deductible health plan at the time for a family. It was about $10,000 deductible.
Right.
But from premium savings, we funded 100% of the $5,000 IRS limit for HSA deposit for each subscriber. And that's, as you know, money that they get to keep. If they don't use it, they get to roll it over, grow tax-free or tax-deferred as a retirement account for them. They change jobs or whatever, they get to take it with them. So I thought that was would be a pretty interesting way to make people kind of care about what the costs were a little bit.
Right.
And then we indemnified them also to say, okay, well, you the deductible is up to $10,000. You only have $5,000 in your HSA. If you're among the unlucky ones who actually burn through your HSA dollars, and this was before you could invest it, so most people would spend right out of their HSA on their debit card if they had care. If you went over the $5,000, you just bring your EOB into HR, and we'll cut you a check for the difference until you hit the 10,000 limit, at which point that catastrophic HDHP health plan would kick in and pay everything.
Right.
So, it was a little bit complicated for people. This is weird, it's weird, but it's like, yeah, but if you're healthy, you could have an extra $5,000, and this was $2,005. So this was, even more meaningful than it is now in terms of value to them. And what we saw was quite amazing. The company actually saved 32% on what it would have cost to just buy all platinum plans for everyone, even with that rich benefit, even with fully funding of the HSAs. And then I surveyed the employees at the end of the first year to see kind of how much money they had left in their HSAs. And I found out that on average, they had about 75% of the HSA dollars left.
Sure.
And then because New Hampshire, where we're based, has had MLR, medical loss ratio rules like we have on a federal level now. When my renewal came in for the company, we got a 7% reduction in premium. So it's like, what's wrong with this? This is like everybody should be doing it. Well, I'll tell you what was wrong with it. I turned all my employees into consumers of healthcare.
Right.
When you become a consumer of healthcare, a true consumer, you become a very frustrated consumer. And, why are you frustrated? I think we all know. Why do you become frustrated? It's because you walk into the medical facility or your doctor's office and you ask the normal consumer question, how much is this going to cost?
Right.
And they go, oh my goodness, aren't you insured? What's wrong with you? It's like, no, I'm covered. I care how much it costs. Well, we don't know how much it costs. We can't tell you. We can't figure it out. We won't know until possibly 3 or 4. This is back in 2005. It could be 3 to 6 months before we'll even know how much it's going to do.
Yeah.
Because all these forms are flying around in snail mail.
Right.
Back then.
Paper claims. Right.
Yeah. So that was pretty frustrating when you became a consumer. Now, it turned out the employees really loved it because they made out like bandits on the money. I still have people coming back to me and saying when they worked for one of my companies, which I've been doing that since 2005, that same plan design.
Wow. They
come back and they say, it's the best plan design I ever had. Best plan we ever had. I'm still using money from that HSA to cover other, out-of-pocket expenses at my new company. Stuff like that. So anyways, it was a frustration for all of us, though, that we couldn't get the information we wanted to get as consumers. So roll forward a little bit. I built 2 tech accelerators here in New Hampshire, intended to help startup companies getting going, leverage some of the past experiences my team and I had. And I got pulled into a bunch of legislation in Concord, and they're saying, like, what can we do to help small companies? And, one of my pet peeves was, well, if we could get providers to post their, cash pay prices, or we could get them to, put the schedule of the discount rates for the carriers that we use, then we could leverage this thing that I do with my companies called high deductible health plans and HSAs, and we could shop and go to the highest quality but the most appropriately priced care like a normal consumer.
Right.
Well, I recognized what the healthcare lobby looked like when, after driving up to Concord for the 3-hour meeting, with the Health and Human Services House panel, and the lawyers all coming from AHIP from Washington, D.C., and the Anthem Government Affairs Committee, Government Affairs VP walks across the street from her office near the State House, and everybody's like, yeah, nothing's going to happen that they didn't think of, right?
Of
and
course.
This is something they have any interest in seeing happening. But what happened was I discovered in that communication, there was a state level database called an all payer claims database. And being a technology guy, understanding, Amazon's cloud servers, and I was an early adopter of mobile first, application development and things like that. I just said, well, okay, we can't get them to post prices or tell us what their negotiated rates are. But guess what? If I can get my hands on that state level all claims database, which is post adjudicated, I can back into all the negotiated rates for all the payers.
Right.
And at least I could fix it for New Hampshire with a mobile app. And really, what was I doing? I was fixing it for myself and my employees, right? Because we're a perfect example of the frustrated consumers. So with that, I came back to the tech accelerator called the New England Innovation Center, and I found my co-founder, Matthew Robinson, who is our technical director for the center. And it was 6 months after I discovered the thing, but I actually got a CD-ROM that had 100% of every post-adjudicated claim that occurred with a payer in the state of New Hampshire. Every single post-adjudicated claim with all the allowed amounts and the billed amounts and the CPT codes and all that stuff on it. And I went to him and I said, we're going to start a new company to fix this problem. I have this yellow sticky note from Dr. Stein, who was the doctor who had taught me about high deductible health plans in the first place. And on it, it had a CPT code for a nuclear stress test because when I'd been in his office earlier that summer, I had a right branch bundle block on my EKG, and he wanted to send me for a nuclear stress test. So when I asked him what it was going to cost, he said he had no idea, but I wasn't going to drop dead. So he gave me the CPT code, and it was my 53rd birthday, roughly. And he also gave me a colonoscopy code because I hadn't had my first colonoscopy yet. So he said,
shame on you.
when you figure out how to shop these things, you give us a call. We'll send the order wherever you want. That's no problem.
Yeah.
So that was the experiment. DVD-ROM with the claims database for 2012 in New Hampshire. Yellow sticky note with 2 procedures that I had to find the lowest cost and the highest quality. But what I was really looking for is I wanted to know what the lowest costs were in the state. And when we got that data and started digging into it, it blew our minds.
Yeah.
We took the top 100 most frequent procedures that were occurring in the state of New Hampshire. We pulled them all out of the claims. We said, how much did everybody spend at each place they went to?
Right.
If they'd gone to the lowest cost place in the state rather than the place they went, how much would have been saved? And it came out to 72% of all claims costs would have been saved if everybody went to the lowest cost provider of the top 100 procedures. That was like blew our minds. So we started reporting out on this sort of stuff. And I think now at least people in the industry recognize that there's a huge disparity in in-network negotiated rates.
Mm-hmm.
You may have the best discounts from your Blue Cross Blue Shield Association member because they may be dominant in your market. But what you don't find out from them typically is that where you go, which facility, on which side of the street or even what side of the building you go can significantly change the cost. And there's like 25x difference high to low on most kind of non-office visit type procedures. So most of the things that people that hadn't been checking carefully. So anyway, so we built the company a lot differently than there were transparency companies that couldn't help me with my CPT codes and couldn't help me find specific providers. They were really captive by a lot of the payers that didn't want the prices to be known. They also didn't want to get involved in directing people from one provider to another necessarily because they're contracting with lots of providers and they didn't want to play favorites, I think. So they tended not to want to get into this. And then, of course, the old 80-20 rule or the MLR rules, create a perverse financial incentive in the system that, who would blame a fully insured carrier for them to not want you to necessarily navigate to the place that's 95% cheaper than the expensive place.
Right.
When you consider that they're on a cost plus basis contract effectively, and for every dollar that is saved for the consumer, they lose premium, they lose revenue.
Right.
And so, unfortunately, that perversion makes them, in some cases, act as they should when they're put in that position. We'd probably prefer they didn't, but if you were on the line to drive profits and drive revenue, you wouldn't really be terribly interested in being forced to cut your revenue in half by helping people navigate to the lower cost locations. Right. So these are the sorts of things I learned as an employer, and then getting into this and more deeply. So what happened is we obviously didn't want to stop for just New Hampshire. We started expanding first regionally in New England. We did a lot of that using these all-payer claims databases. So we managed to get Maine, Massachusetts, Connecticut, which also had good databases.
Right.
APCD had been developed by the folks from the University of New Hampshire originally under some legislative initiatives way back, like 20 plus years now. And they ran the APCD Council, and we're kind of going and seeding the rest of the country with ideas on how to do the same thing New Hampshire had done. So we kind of followed that, and because New Hampshire let us get access, a lot of the other APCD states let us get theirs. And then we built a bunch of additional technology that would allow us to kind of crowdsource claims out of subscriber portals from their health insurance plans, right, so that we could bring any employer group into the system and then farm claims out of their employees with the employee's permission, farm claims and back those into our database for crowd use effectively. And in 2018, we were doing a launch nationally, and it just so happens that I got an invitation to meet with Katie Talon, who was the White House advisor for health policy in the West Wing. And I showed her what we had built, why we built it, showed her our shared savings reward program, which takes money out of the pockets of overpriced providers and splits it between, plan participants and plan sponsors, right. As incentive to care about price if you happen to be on a copay plan and maybe you don't care what things cost so much. Showed her all that, and showed her why we'd done it. And a lot of people, believe in DC, had no idea that the in-network negotiated rates were as wild and wide as they are, because that information had been well hidden by the industry.
Right.
So,
Intentionally, yeah. It's not an accident.
And by the way, there's wide variation in Medicare rates, almost the same percentage, believe it or not. It's just slightly lower magnitudes because that's all compressed.
Right.
But it's still very wide disparity in prices depending on where you go for the procedure. So anyways, for about 2 months, she shuttled me around DC, and we demoed and explained, et cetera, and so forth. And that culminated in the big powwow a little after Thanksgiving 2018. And those meetings resulted in this guy, Andrew Bramberg, who was the domestic policy counsel on the cabinet, deciding to go ahead and use the Affordable Care Act, Obamacare. And keep in mind, this was a Trump administration now. Right. Use Obamacare, rulemaking under Obamacare, to create a new rule called Transparency and Coverage Rule. And that got incredible teeth to it. Yes. The rule basically says 3 things, 3 phases. First phase is, and this is as the law is stated, not necessarily the way it's implemented, but the law is, and the rule says, January 1st, 2022, all plan sponsors, aka employers offering commercial health insurance, must assure that an in-network machine-readable file is posted on the public internet, which exposes all the in-network negotiated rates their plan is willing to pay on behalf of participants.
Right.
That's a key one. And that was intended, honestly, to allow all types of app developers and analytics folks to be able to suck these prices up, and also quite directly to say, hey, Talon, Mark, you guys shouldn't have to back into that by fishing through the tea leaves of historical claims to find, from what was to find out what is going to be. You should be able to get to those prices. And what they said is the way we're going to do that is we're going to use the fine, our ability to levy fines against plan sponsors, employers, up to $100 per member per day for noncompliance. And they can do this because employers, take benefits of writing off these expenses against their profits and their taxes, and Department of Labor oversight on how they treat their employees and things like that. There are a lot of rules they have to follow, and the federal government has the right to levy fines if you violate those rules. So they're basically using that, employers and that, as a big hammer on the industry to now open up price transparency. So that was phase one. Phase two was January 1st, 2023, that all participants and then members, and that amounted, according to the rule, 212 million members of commercial health plans, need to be provided with a internet-based consumer price comparison tool that shows the actual negotiated rates, as well as patient out-of-pocket responsibility and in and out of network guidance. So, and a bunch of other specific things. But
Sure.
effectively what it said was the stuff that Talon showed us, we now know it can be done.
Right.
And therefore we can require it. So they mandated it on everybody at that point. And that January 1st, 2024, it's not just 500 services, it's all services.
Wow.
So we really have to do it programmatically. It's a very complex thing. We feel really lucky. We weren't trying to, create a problem for people. It's a lot of effort, but it's going to be great for the industry, for employers and employees and consumers. And it'll be good for those who innovate in the provider and payer space also, because the markets will adjust with efficiency as you bring the consumers back into the marketplace.
Right.
And it'll create opportunity for those who want to drive innovation, make things better, faster, but cheaper,
Right.
better quality care, lower costs. These are the things that mass markets reward when you have, symmetric information between merchants and consumers. So, that's what we're all about. Now it used to be we sold only with and through brokers to employer groups.
Right.
A lot of consultative discussions around how to build plan designs so your employees care what things cost, but you don't end up costing them more out-of-pocket expense. So, if you're going to go with a high deductible health plan, which I would recommend everybody honestly consider it, if you do it right and you provide a funded HSA account that's commensurate with, what the appropriate deductible amounts and stuff, and effectively dollar for dollar on an actuarial basis, when you provide an HDHP to your subscribers, you're actually getting more for it than you are with a copay plan.
I wanted to jump in because one of the things, like, if there's plan sponsors out there listening, what they just heard, but maybe didn't realize they heard, is the burden is on them. The Department of Labor cannot impose penalties on a third party. This isn't something your insurance company has to do. This is something you as a plan sponsor has to make accessible to your members. And, if you're fully insured, your insurance company is very happy to, at least give the perception that they're helping you comply by putting this on their website, somewhere where it's not necessarily very easily. They're not promoting it. They still don't want your members to be consumers because it hits them in the pocketbook at the end of the day. But as an employer, really the opportunity here, I guess the whole point of this is that you can empower the consumer who's been groomed by 30 years of managed care, really groomed deliberately. It's doctors are good people, but they work within a managed care system like your doctor became part of. And I love direct primary care. It's not booming here in New York yet. There's one on Long Island that's full-time brick and mortar. My daughter was on the other side of that door that was knocking a few minutes ago. She's a patient of that doctor because the care is night and day what you get when you go to a doctor. And it's not because the doctor doesn't want to be a good doctor. It's because the doctor's got to see 100 people per day, has 7 minutes on average, and spends 5 of those 7 minutes typing the notes. Because if they don't put those notes in the system, then they got to work 4 hours after, the day's over. So I want to talk about the plan design though, right? So the technology is great. It can help the employer comply, avoid those. And when you said, hopefully the listeners are per member per day. So that's per enrolled person, belly button. So if you have a family of 3, that's 3 people. That's $100 per day per family member. That's where that $80,000, on average, let's say, you use a 2.x, whatever it is, times 36,500. Except on leap year, you get one extra day of penalty. So if you take a plan today, and because HRAs have been around for a while, right? Health reimbursement accounts. That concept has been around for a while. There's a lot of different TPAs that help administer that, right, from the debit card process. But from a plan sponsor perspective, for me, what I fell in love with Talon was that you can take this plan design. Let's just assume you have a platinum or a gold level plan, a pretty rich plan that's in the 80th or 90th, from an actuarial standpoint. Covers a lot. You're paying, and as you experienced, you're overpaying for most of your employees.
Yep.
Right? You're paying because of this fear, maybe the owner themselves, their family, they think, oh, I don't want my members to incur this out-of-pocket cost. They can't afford it. But you can take that plan, you could bring it down to the silver or bronze plan. It doesn't have to be an HSA compatible high deductible plan. It could be a high deductible plan that has a deductible, but maybe it doesn't apply to office visits or prescriptions, potentially. There's a spread in premium and you're saving money. And now you, as an employer, say, well, I'm going to cover all or part of that out-of-pocket cost that I've imposed on my employees, knowing that, I saved $300,000 in premium. I'm anticipating a $200,000 reimbursement. So my net savings after administrative costs and everything is $80,000. That's decent. You did okay, but they haven't solved for the big problem, which is the steerage of the healthcare system and the lack of actionable data. Like you said, if I told you, Mark, right now, hey, Mark, I'm going to buy you a 55-inch TV, but I'm only going to give you $800. You're not just calling up American Express and saying, send me a 55-inch TV, because if American Express makes a VIG, which they do, right? They may send you a $7,500 55-inch TV. Now, that might not be a great example because maybe that's an outstanding TV. But maybe you don't want to spend $7,500. You want to keep it $800. You can do that for any other product under the sun that I could imagine. I can't think of anything else that you can't be an informed consumer and find quality, cost, and no one is going to get there. I mean, that's why Amazon went batshit crazy, because I can have it. Actually, I can make an order today and half the stuff will be there when I get home. But with healthcare, you don't know the cost. The provider doesn't even know the cost. They know their cost, possibly. They don't know what the insurance companies are willing to pay. And that's huge difference, right? But it's almost impossible to get the quality too. So now you do that exact same thing using Talon, and you say, okay, and you mentioned rewards, because I love the rewards. I'm just going to go right to the rewards to save a little bit of time. But you build this plan and you say, I'm going to cover X amount of your out-of-pocket cost, and you give them, the resource they need to, in the moment, to make a smart healthcare decision. And pay less out of their out-of-pocket costs. Under your example, you're giving them HSA funds instead of my HRA example. They get to keep what they don't use. So if they act like the IRS thought people with HSAs would act when they developed them years ago, they thought they'd be more responsible because it's their money. They would be an informed consumer, but it was impossible. You're giving them that power to make an informed decision to keep as much of that HSA. But if it's an HRA, you're helping the employer save money because they make a smart decision, go where it's high quality, lower cost. The company saves money, and now you can give the employee a reward for making that smart decision and maybe another level of HRA potential. So, from a plan sponsor standpoint, instead of paying back $200,000, your likelihood is you may actually end up reimbursing $100,000, maybe even less, right? But more importantly for me, I'm real passionate. People need to be able to find the best doctor. For me, saving money is great. I think that's why people will do it, and they should be able to do that. But more importantly, especially if it's not a commodity like maybe a radiology thing, which you could argue get an MRI anywhere as long as the machine is recent and and the tech's okay. But if you have something that's life changing, life or death, orthopedic surgery, don't you want to see the best doctor?
Yeah, and it turns out there is no relationship between cost and quality. So the tools and the displays that we do, I was just, I saw you lift up your phone. I'm just saying as an example, I just put my phone out and I quickly did a search, and it was a zip code. I was in the Austin area doing a demo yesterday, so I just left the zip code the same. But very quickly, it told me here's 40 places I can get that nuclear stress your doctor wanted you to get, Mark. And you see the little bag of money, green bags of money.
Yeah.
And, as I scroll up to the more expensive prices, the green bag of money gets smaller and smaller. But there's a quality score right there. And you can find that the third one up from the bottom has the highest quality score available in the system. Even though, you can go find a place that instead of being, I think that one was, $680 or something. So that one, it's a highest quality, $708. That's the total cost. I'm on HDHP, so that's my out-of-pocket cost also. Right. At the other end of the spectrum, the most expensive one within that 50-mile search was $7,489. And that's with my Anthem in-network discount.
And that's the important thing, right? Those are Anthem prices.
Yeah.
Because your technology allows you to input. It's not the cash price. There's a lot of different technology out there, and it's important. Some people might want to pay cash. Great. But you're giving them something that's specific to their plan design. And I'm going to go out on a limb and say that $7,000 provider is part of a healthcare system. It's not the doctor.
Right.
That facility, that location is probably, you said it's a nuclear stress test. It's probably a radiology facility located at or near the hospital. So they're getting hospital prices 10 times more than potentially the competitor or an independent radiologist that doesn't have the buying power. And you think about in healthcare and health insurance, size matters. Yeah. But they don't use their size to bring down prices for their members. They're not serving their members. They're serving Wall Street. So they use their leverage to garnish the highest reimbursement. And because they have a consumer that's completely in the dark, that poor soul that doesn't have your tool, that has a $5,000 individual deductible, goes, and even today, even though it's not paper, you still don't know until you've had it most of the time, even though technically, because of the legislation, you could go on the shopping tool on the carrier website, but I'm not so sure that they're pushing the lowest cost at the member.
So let me tell you what some of your your viewers and listeners could think about. So one of the things we've done, because we were really big on the education side, right? Remember, I came at this as a C-suite employer, and my dismay of how my company was being mishandled. Okay, so if you're an advisor to employer groups, there's a huge opportunity here to use transparency and all that brings now to get new business, to basically say, okay, there's some other sleepy broker who's owned an account forever, right? That hasn't really done the things necessary to drive true cost containment, to help reduce costs instead of having these prices constantly going up. And even a flat renewal is not reasonable with transparency. So we have a directed selling technique we call the advisor dashboard, and it's available to any broker, any advisor, anybody who wants to leverage transparency tools. And what it does is it starts with the ability to measure how much is wasted for lack of ability to shop. And it's no cost to the advisor. Running these analytics reports is no cost to the advisor. It's really a selling technique. It helps us because it grows our business. It helps the advisor grow their business. Help your brokerage grow. And so it starts with the ability to actually measure in a claims file how much money could have been saved if people were able to shop and they had the information readily available to them.
Right.
Now, it's shocking. On average, it runs 35 to 55% of all claims costs can be saved through shopping, actually. On average, we see about 41% in these reports as we've worked out.
Wow.
It's shocking. Now, you're never going to get perfect shopping, but it starts the conversation like, okay, well, how do I get my employees to care? And how do I get them to care and not spend too much time worrying about it instead of doing what they're supposed to be doing or what they'd rather be doing, hanging with their families, getting their jobs done or whatever? And the answer to that is you have to have a plan design that drives a consumer incentive to care.
Right.
Then you need to put in their hands something that's totally frictionless, 15 seconds or less, shows them all the places they can go, that they can literally launch it on their mobile phone while they're with their doctor, or at least with the doctor's business office. So before they ever leave the building, it's like, doctor says, hey, Lou, those headaches you were complaining, we want to send you for an MRI of the brain. You quickly search it out. And to your point, it's kind of commodity MRIs now, right?
Yeah.
And so, hey, doc, here's all the places I could go. There's one halfway on my way home here that's $600 instead of the $3,000 one that's across the hall from your office. Any problem with me going to the one that's $600? I can tell you, doctors don't want to hurt people financially. They want to help people. My experience is that they're fascinated when you pull this device out and they want to look up a bunch of things. How did you know that?
Absolutely, because they don't know.
They don't know. They are on the good guy team. They are white hats. They care about their patients typically, and they want to help their patients. So, so the idea is that, and so we have this thing called a consumer interest calculator. So as a broker advisor, you can walk into a new case that you're not with yet, and you can get a copy of the SBC, their benefits summary, and this calculator lets you enter the parameters of those plan designs. And it calculates the likelihood that those employees care what things cost.
Right.
And it's shocking because most plan designs are designed specifically to remove the consumer from caring. If you got a $200 copay no matter where you go, and one place it's, $500, another place it's $3,000, you might even prefer the $3,000 cost one because you're only paying $200, right? And it may be lower quality. So this basically becomes a consultative sales opportunity to put a wedge between an existing broker that hasn't really done anything for their plan sponsor, the group that they've been serving for 5-10 years, and a new advisor who's basically saying, hey, I want to build a book of business. I want to do the right things for people. And so those tools are available as part of the system, and they're no cost to advisors. And, it's the idea here ultimately, and there was a lot of discussion. I remember there was some discussion with the chief of staff for HHS, of all things, at the federal government when I was there back in 2018. And we were trying to figure out what percentage of consumers in a marketplace need to be shoppers to cause the market itself to react and become efficient and lower cost for everybody. For instance, you and I probably go to the supermarket.
Yeah.
We don't worry about the cost of the head of lettuce when we grab the head of lettuce off the counter and throw it in the thing. We just need a head of lettuce. But somebody else was watching the Sunday flyers.
Yeah.
And making sure that keeping that supermarket honest on the head of lettuce. So we're not going to end up with a $20 head of lettuce when it should be $3.50.
Right.
And so it turns out it's like 8 to 10%. If we can get 8 to 10% of the healthcare consumers to actually take 15 seconds and do a quick shop, do a little shopping, and then vote with their feet in their wallets and their quality considerations, the market will start to really reward innovations that increase the quality and decrease the cost. Just like we saw, my first flat screen TV, $12,000 Pioneer. That was half of retail price because I shopped it.
Wow.
That was a 50-inch plasma TV.
Yeah.
I bought 85-inch for our conference room here, delivered 85-inch LCD smart TV. It was $1,299 delivered.
Wow. Yeah.
And that's the power of consumers in a mass market and rewarding innovation. So
the consumer, and we started. We had a short call before we jumped on this. Call earlier, and this is my 32nd year. So when I started in benefits, there were no managed care, there was no network, there weren't HMOs. You went to the doctor. The doctor had a price. The doctor was hoping that what he charged was reasonable and customary, because if it wasn't, the insurance company would knock it down, and then he had to explain to his patient, either I'm worth it or don't worry about it. Like a body shop, don't worry about your deductible. Just come back next time you have a wreck. But they took that relationship away. And the discounts in the early days of managed care, I think U.S. healthcare might have been one of the first ones to come through the New York area, and HIP was here. And they were true discounts because the prices hadn't changed yet. And the hospitals, these, North Shore Hospital was two hospitals. LIJ, Long Island Jewish Hospital, was a separate hospital. And the prices were hurting them. The discounts, they were like, shit, we're actually bringing in 40% less in revenue because these are early HMOs had, whatever the discount was, 20, 30, 40%. So they got smart and said, these insurers aren't going to be able to push us around as much. We'll have much more leverage negotiating higher prices if we join forces. And they let them. And now you have these health systems that are 30 hospitals. I think there's one that's up to 200 hospitals on the West Coast, right? Mm-hmm. That was bad enough. You had this horizontal mergers within hospitals. But they didn't stop there. They got smart and said, hey, what if we take over the specialists and the facilities and the radiologists and the labs all the way down to the primary care doctors? Right. Now they work for them. Now they have they cover the whole gamut, and they use the primary care doctors and the specialists as the shepherds to drive people to the lowest value care, the highest price, with no increase in quality, like you said. And that's what's happening. But the consumer doesn't know that. The average person who goes to the doctor goes to their doctor and thinks, this is my doctor. Doesn't understand the economics behind it. And that's what we're up against. And you have these companies, you have the Aetnas, the Cignas, the Blues, you have the United Healthcares of the world that have gotten massive. And their shareholders don't want that revenue to go away. And there's pharmacy benefit manager investigations happening at the Department of Justice, all this stuff. And you mentioned it earlier. They are 10 years ahead of us. They know what percentage of people are changing their behaviors. They know, because they can tell by the numbers, why is our revenue, why are more claims going to non-hospital system doctors? Where are our primary care doctor visits? Because people are using virtual primary care or direct primary care. Those claims don't hit them. So they know, and it's like, I always use this, I'll credit Eric Silverman for this. It's like an English muffin. You look at an English muffin, it's nice and smooth. It's got cornmeal on the outside. You cut it open, every one of those nooks and crannies is where the profits are that you can't see today. And as soon as one of those dries up, they create a new one, and they're doing it today. They're not going to give up that easy because capitalism, greed, whatever you want to call it, is human nature, unfortunately. So unless the consumer, the employer, and the patients and the members understand the role that they play, right? Managed care wouldn't exist if the consumer didn't decide back in the early 90s, we like this better than indemnity plans. We like $2 and $5 copays, and we're willing to go through this pain to learn this new thing. What's a copay? I don't know what copay is. That was my job as an advisor in the 90s to explain the new plans and hand directories out to people, which would literally throw them at me because their doctor weren't in it, right? That's when the owners of companies came to the meetings.
Yeah.
We got to give them another reason to come. We need the C-suite to say, hey, explain this real consumerism. I call what you guys are doing real consumerism. It's not just thinking people's behavior is going to change because you're throwing a higher out-of-pocket cost at them. If you don't have any tools to make smart decisions, that was useless. But now you can really leverage plan design with incentives to change the consumer's behavior to get them to the best doctors. And in doing so, and think about this, for that employee who might say, well, what do I care? I still have the same out-of-pocket cost, right? You could completely understand what you're saying, but every penny that your employer is paying more in health insurance premiums is a penny they can't spend on their employees. Bonuses, pay, all of that stuff.
Yeah, that's a tough thing for the employee individually to follow. Yeah, collectively we should all kind of think that way, but that's not what it works. So the behavioral economics behind all this is literally, it's got to be very individualized. The individual has to see the financial implication quickly,
right?
Understand the scale of it. Can't be hidden behind a year of adjustments and things like that. So this is all stuff that we've worked out over 10 years. We've the shared savings reward system, and interestingly enough, most recently we just announced something called Talon Pay, which is an in-app digital presentment multi-purse debit MasterCard. And so those rewards, those shared savings rewards, that the employer gets to pick what the amounts are, relative to the savings they get from the good consumer behavior of their participants. They split, those savings with their employee. They give some to the employee, they keep some for the bottom line of the business. But those things can now flow into this fully integrated debit MasterCard that can be used to turn around almost immediately and spend these dollars out from the rewards. So it's a very immediate economic benefit to their family. If it's something like actually shopping for a hip replacement or a knee replacement, something bigger, the reward could be a couple, $2,000-$3,000.
Sure.
It can pay for your kids' braces. It can pay for your hearing aids. All types of things. So
that's great. I actually got the flyer on that, and I was going to ask you, but I'll have to follow up with your sales team on that because I got this. Like, oh, that's new, and because you're a tech company, it's not stagnant. You guys are ahead of the competition. You really provide an amazing resource, benefit. I have my website up there. I'm going to put yours back up there in a second because, if you're a benefit advisor and you're not thinking outside the box, you're really not long for this industry. And if you're an employer and you're just going to, stay the status quo, you're going to disproportionately keep paying more and more of those skyrocketing premiums because you're not just feeding the system, you're feeding Wall Street and things like that. And I don't know if we're at 8 to 10% yet of the market changing. I'm part of Health Rosetta. If you're familiar with Health Rosetta, Dave Chase and his team there. I'm one of the Health Rosetta advisors. I'm part of another organization called Aspirational Healthcare. And it never ceases to amaze me when I get on a call or a demo or a discussion, what other advisors are doing in other parts of the country, the resources that are out there. It's overwhelming because there are so many people and individuals and companies that are really attacking this problem, we kind of follow the KISS, keep it simple, stupid. We're meeting employers where they're at and saying, okay, this is what we would recommend to be the first step. I talk about self-insurance all the time. It's not for everybody. It's probably for most large companies because they don't understand claims are not the claims. You have we had one member on one of our groups that just won a Health Rosetta Rosie Award as one of the top 50 health plans in the country. They were self-insured. They had one claimant that was over $600,000 for the last 5 years with a laser in the upper 400,000s. And finally, they had breached their aggregate. They had several. The report of large claimants was out of this world. I mean, it was really, they had to do something. And all we did was move them to an independent TPA, an independent PBM. We implemented more advanced case management to support those members, especially their most vulnerable, that 5% of their population. That one member's claims dropped by $400,000.
Yeah, and I would say it's going to an independent TPA is a very good move right now. They're a lot more agile. They're willing to bob and weave and do the right things to help you with cost containment. They'll bear a lot of the brunt of the complexities so that HR doesn't have to deal with it. And what I can tell you is since the transparency and coverage rule became law and became active, about a year and a half ago now, or a little over a year ago, we've signed over 60 independent TPAs that they're supplying our technology to their entire book of business. So a lot of these independent TPAs see the value of the innovations and the ability to differentiate. And most importantly, I would say, they basically have taken the responsibility to make and by the way, they're not on the hook for the fine, right? Like you said earlier, but they're taking the responsibility to make sure that the employer group is covered and is not going to get in trouble potentially with the Department of Labor, Health and Human Services, or the IRS with this fine. And the fines, nobody's really been fined on that yet, but it's coming, probably another year or so. Give people a little bit more time to kind of get in place. And as long as you're doing the right things and you're taking it seriously, you'll stay out of harm's way, I think. There's kind of the safe harbor provision of these things. But you also can't forget, as an employer, the C-suite has a fiduciary responsibility to plan members. And Department of Labor and a lot of attorneys and litigators have started to say this is going to be low-hanging fruit.
Yes.
And the last thing you want is your customer, the group you're serving as an advisor, or your company as an HR team member. The last thing you want to see is these kind of company killing fines or litigations coming down on the company's head. So, there's some time to react still, but I wouldn't sit around and wait much longer. Yeah. And I appreciate you putting up our website there. We'd love to work with people on this. So we're very passionate about it, and love to find passionate people that want to help with this movement. It really is a movement.
It really is, and it's one that has to take place. There's no one coming to the rescue. I don't think the government's ever. They like to talk about things. They're not coming to the rescue. The legislation that they've implemented over the last 10 years, even a little bit more than that, it provides an opportunity, but they're very aware of what the largest insurers and health systems are. Those are the two biggest lobbying groups in the country. Exactly. They shrink everything else in comparison, so they're not likely to go in back there and lose that source of revenue. It's up to the consumer, absolutely. So I really appreciate it. So I told you they go back now. We're at 59 minutes right now.
Look at that.
Where this was great, I can't wait. I really think 2024 is going to be a big year for your company. I hope it is. I hope people will take us up on some of the solutions we can help them with, fiduciary, cost, things of that nature. So this was great. I really appreciate you taking your time out of your day today and joining us here.
Well, thank you very much, and I will some hope here for everybody. We take every penny we make and we turn it back into growing the business and helping drive this movement. Last year we were 576% year over year growth.
That's amazing.
This year we're over 300% as we sit here in October. So, that's a lot of people joining the movement, and we turn every penny back into growing and getting more consumers on board, and it's I think we're going to see a big difference as in the coming years as things the puzzle pieces continue to fall in place, and consumers get more comfortable with actually becoming shoppers and involved in healthcare. So thanks so much. I really appreciate your time, and it's been great chatting with you.
Sounds great. I appreciate it. Thank you. Have a great fourth quarter.
Yeah, thank you.
Take care. All right, bye-bye.